Welcome back to the Health Longevity Secrets Show with your host, Dr. Robert Lufkin. His new book, Lies I Taught in Medical School, has been named a New York Times bestseller. And now, please enjoy this week's episode as we explore the secrets of DNA testing with Dahlia Attia-King.
This week, we unlock the secrets of our DNA and take control of our health destiny as we join Dahlia Attia-King, the innovative CEO of Panacea, as we examine the transformative potential of clinical-grade gene sequencing. We delve into how this new technology eclipses the consumer-grade genotyping that you might know from popular companies like 23andMe and Ancestry.com. This is offering a more comprehensive analysis with the power to revolutionize disease prevention and personalized health strategies. Dahlia's insights into the cutting-edge advances in whole genome and exome sequencing will leave us awestruck at the possibilities that lie within our very own genetic code. Now, when it comes to the intimate details of our genetic blueprint, protecting privacy is paramount. Panacea's trailblazing use of blockchain technology ensures that the power over our personal genetic information remains firmly in our hands. Dahlia and I frankly discuss the ethical landscape of genetic testing companies, the vital importance of consent, and the profound consequences that informed access to one's genetic information has on individual health choices. Listen to heartfelt stories that underscore the dramatic impact of understanding and acting upon genetic risks, which, contrary to popular belief, can often be mitigated with the right lifestyle adjustments and medical interventions. This episode is sponsored by SciFox Health. One of the most common questions I get asked is which blood tests I check myself on a regular basis. Well, I check 17 biomarkers, but the secret is I'm able to do everything from the convenience of my home. I collect a sample with just a simple finger stick like this. You don't need to be a doctor to do it. Then I just mail it in and wait for the results. SciFox Health makes it possible. Use the link below to get 15% off. This episode is brought to you by L-Nutra, maker of the Prolong fasting mimicking diet. If you'd like to try it, use the link in the show notes for 20% off. And now, please enjoy this week's episode. Dahlia is the founder and CEO of Panacea. Her experience working for genetic laboratories exposed her to the reality that very few patients were able to access valuable preventative clinical genetic tests. Panacea was founded with a mission to improve access to clinical genetic testing so that people can get in control of their health and prevent disease. Hey, Dahlia, welcome to the episode.
Hey, Dr. Lufkin, how are you?
Great. I'm so excited to talk today about DNA, it's all in the news, gene sequencing, genotyping, and what all the subtleties are, all these different things. So maybe you could just start with just a basic question. Everyone's familiar with 23andMe and Ancestry.com, sort of low-cost tests. And maybe you could distinguish those compared to other types of tests that are available.
Yeah, so I always like to start out by explaining the fact that there really are two leagues of genetic testing. And the difference between the leagues really centers around the fact that different technologies are used in assessing and reviewing the genes of an individual. The very common type of genetic test that we see through a lot of direct-to-consumer companies is not really clinical grade testing. And the reason it's not clinical grade testing is because it uses a technology called microarray that sort of looks at your genes in a very surface level manner, right? Microarray is essentially a search and find technology. It looks for a predetermined variation that could exist in your genetic makeup or in a particular gene of interest. And if the particular sequence or the particular arrangement of the gene is not there, then essentially a patient might test negative for that particular change. The problem with microarray and with this type of surface level testing is that it's not really finding what it's not looking for. And it's usually looking for very limited things. And so when you get a test through one of the common direct-to-consumer companies, you're usually getting a limited kind of surface level view of your genetics. So it's not really clinical because it lacks that depth and breadth of information. The second league of testing is really clinical testing. It's testing that your doctor would do. It has to be ordered by a doctor, essentially, and it has to be provided by a clinical laboratory. This type of testing centers around a technology called next-gen sequencing. And next-gen sequencing is the literal reading of every letter of your genetic alphabet. It's very comparable to me saying, hey, doc, read me this paragraph, but don't read me every word in the paragraph. Read me every letter of every word in the paragraph. So you can see how thorough and deep it is, especially when you compare it to a search and find technology that's literally looking for one word in a paragraph. And if it's found, great, it's highlighted. If it's not found, then you have no idea what the paragraph's saying, right? And so when it comes to understanding the differences between genetic testing, I think consumers really need to understand those two core differences: the depth and breadth of information, that's provided by the different technologies. And that's kind of the high level overview on the differences of genetic testing available today.
So to summarize, if I understand it correctly, then the consumer ones, the companies, the names we mentioned, and many others use this microarray technology that looks for, I think they're called SNPs, right? The
Exactly,
single nucleotide polymorphisms. But what you're saying is, because of the way the technology is set up, unless you have a detector for a particular SNP, if you don't look for it, you won't find it, essentially.
Precisely.
Versus this new, more advanced testing where we're not using microarray, but we're actually sequence. I think the consumer one's called genotyping in many ways, right? And this is called gene sequencing, right?
Sequencing, correct.
You actually sequence the entire genome. Now, in sequencing, I understand there's a couple types of sequencing, right? There's the whole exome sequencing versus whole genome sequencing. What's the difference there, and what is necessary and what's valuable?
Sure. So that's an important question, an important thing to understand. So whole exome sequencing and whole genome sequencing are still utilize the same technology, right? But there's a key difference between them. Whole genome sequencing is the sequencing and reading of every little tidbit of genetic information, right? Held in your genome, in your entire DNA library. The whole exome sequencing is quite similar, except it's more focused on just your genes. Now, people kind of look at me like I have four heads when I say this, because sometimes they don't realize that there's a lot more information held in your genome than just genes, right? There's genetic material that exists between the genes that in whole exome sequencing is not really looked at, right? We only look at the genes, the areas of your genome that code for proteins and essentially give your body instructions. The reason why that is so valuable is because the vast majority of genetic changes that are understood today that affect health and disease occur because of variations or mutations in the gene areas in the exome, essentially, right? So you're really sequencing a more focused area of the genome that really has the most valuable information. It's a lot more cost effective to do that because, of course, you're not sequencing everything. You're sequencing all the areas of interest. And it actually yields a lot less information that is unuseful, right? because there's going to be so much information that's delivered through the whole genome. But the problem is a lot of it is just not useful. We don't understand it. We can't interpret it. We don't know what it does. And so if we limit our focus just to the genes, the areas that code for information, for biological instruction, then we get a lot more useful data and a lot more cost-effective data.
So then the low cost genotyping, looking at SNPs is a sort of consumer thing, but now we're moving to the clinical grade whole exome sequencing. And the exome word sounds like exosomes, which we've talked about with stem cells, but it's a completely different word. This is
Completely.
exome, not exosomes. But this whole exome sequencing is a clinically grade a way of looking specifically at the genetic material. And it's more cost effective than doing whole genome sequencing, where you include a lot of unnecessary material. So it's a more affordable way to get clinically actionable results. So
that's exactly right.
What kind of things are you finding with whole exome sequencing that I wouldn't be able to find in my genotyping, my low cost consumer one? So what's the
Sure.
incremental advantage here?
Sure. So from my understanding, what I'm hearing, a lot of direct to consumer companies who are offering um, just your average microarray type of test, they're usually looking for certain variations in maybe a couple genes, maybe BRCA, maybe a couple other well-known oncogenes. But the reality is they're looking for very small changes in very few genes. The difference when you're doing a next-gen sequencing with either a very large panel of genes or all of the genes in the exome example and whole exome sequencing, you're really reviewing every single well understood gene when it comes to health and disease risk, essentially. So the areas that we understand today in genetics are centered around oncology. So gene changes that could influence your risk for developing cancer. Cardiology is also a growing space in genetics. Neurological issues and rare diseases. Those categories, those bulk categories, are really where genetics and genetic testing is useful today. And as you might know, the areas of genetics that we are sort of beginning to understand more and more are the areas of single gene changes, right? So we understand how a change in one gene or a few changes in one gene can affect our development for disease or our susceptibility to develop diseases. The areas that genetics still hasn't really delved into and likely will in the future are the areas of changes in multiple genes. So a lot of diseases are likely caused by changes in multiple genes. Diabetes, for example, is a complex disease that likely occurs because of changes in multiple genes. Autoimmune diseases are likely caused by changes in multiple genes. We haven't quite narrowed that area down yet. We're still quite kind of, unraveling the complexities of all of that. But today, the areas where genetics and genetic testing is really helpful is in understanding and identifying those changes that occur in one single gene. And like I said, oncology, cardiology, some neurological disorders and rare diseases all occur from those single gene changes.
So the real advantage, as you say, then is the single gene mutations for single diseases. But on the frontier, what we're hopeful for, what we're looking forward to is multiple genes, polygenetic origins of diseases. But it takes a while to develop. Now, is it correct to say that whole exome sequencing, because it sequences the entire exome, will be in a better position to identify polygenetic influences than, let's say, a microarray system like genotyping with the consumer grade ones, which only identifies certain SNPs? It might miss some of those relationships.
Absolutely. And you're spot on with that. So when you're looking at everything, you can sort of, you have a better opportunity to build a more realistic, fuller picture. And if you're only looking at certain things, it's going to be very difficult to start making those connections. And so when you have a test like whole exome sequencing and you're essentially looking at the entire genetic library, you can certainly begin to pick up on trends and patterns that might exist among all of your genes. And the really interesting thing is that whole exome sequencing is not just valuable to you today, it is essentially valuable to you for the rest of your life. And the reason for that is your exome doesn't change. Your exome is essentially the genetic combination that you inherited from mom and dad. And that is never going to change. You will have the same exact combination for the rest of your life. And so sequencing all of your genes in one shot, in one test, just once in your life, is really, really valuable for you today and for the rest of your life. You can continually make comparisons of new developments and new discoveries against your exome. So you only need to get your exome sequence once, and you'll have that, and you'll be able to reference it against any new developments over and over and over again for the rest of your life. That's why it's so valuable to sequence your exome as opposed to just pieces of your genes, and really have that be useful to you forever and ever.
Is there an app like Prometheus is an app using genotyping that allows people to download their data from whichever vendor and then analyze it? Is there a similar app for whole exome sequencing, or does Prometheus
Yeah,
work with that?
Prometheus works. Yeah. So Prometheus is one of the databases that we often see, and we do recommend. We have no affiliation with them, but they're certainly one of those databases that does accept raw data, especially whole exome or whole genome sequencing data, and that data can essentially be utilized to create reports for yourself. And that's a great way to kind of stay up to date with all of those new discoveries that might be relevant to you.
Yeah, and full disclosure, Dahlia's company, Panacea, has provided me at no cost with a kit that I'm going to use myself and get my whole exome sequenced. And after we get the results, I'm happy to share them with everyone, and we'll invite Dahlia back to discuss it at a later episode. But for today, a couple other questions. The consumer oriented genotyping ones we talked about, I can just order on Amazon or something, but the clinical level ones like whole exome sequencing that you provide require a doctor's prescription. What is it about the information that exome sequencing provides that I need a doctor to hold my hand, whereas if I get it from, one of the consumer vendors, I don't? Or how does that, what's the difference there?
Yeah. So this is a great point, and one of the reasons why we exist, why Panacea even exists, is because we noticed that this test is essentially life-saving. It can be life-saving, and the only way to get it is to get it from your doctor. The problem is that insurance companies are not very widely covering this type of test, unfortunately. And doctors are sometimes hesitant to order a test for their patients that they know insurance is not going to cover. The other issue is, ironically, not all physicians are very well versed and trained on how to utilize genetics in the care of their patients. And so sometimes they shy away from ordering this type of test. It can be complex, and interpreting what the results mean is also a complex thing. This is exactly why Panacea provides a free session with a clinical genetic counselor so that this information can be deciphered and next steps can be identified. So you can kind of use this information to make healthcare decisions for yourself with your doctors moving forward. I think, to answer your question, one of the reasons why this test needs to be ordered by a physician is because it can actually guide medical decisions. If you are an individual that has a increased risk for breast cancer, cancer, for example, or ovarian cancer or colon cancer, there are specific actions that can be taken to minimize and in some cases completely eliminate your risk. And those decisions really need to be guided by a medical expert, which is why these tests are clinical and they do require the order of physicians. And of course, at Panacea, we handle all of that for you. We have physicians that we partner and collaborate with that will order these tests for you. We have genetic counselors, as I already explained, that will interpret these results so that you can understand what to do with them. And then you can take all of this information to your physician and sort of create a very specific healthcare plan so that you and your physicians can really be in control of your health and get ahead of the risks that are carried in your genes. Does that answer your question, Doc?
Yeah, absolutely. And as I said before, I'm happy to share my clinical consultation with everybody. We'll record it as a podcast to go up and let everyone see what that's like, and they can experience it as well. Now, talking about data privacy, like, I get all this information that's me, my whole life. It's not going to change my whole life. Maybe I don't want to share it with my physician, and maybe I don't want to share it with my insurance company. I remember back when genotyping, the consumer ones came out, a friend of mine, I was discussing this with a friend, and he said, well, if you send in your information for your consumer grade genotyping, be sure and use a fake name, because you don't want it tied to your real name. And somebody pointed out that it's sort of like sending in your photograph with a fake name. The photograph is identifiable. The genetic material is more identifiable than your name. They'll be able to track your ancestors and, and all your relatives and everything as well. What do you think about data privacy, and what's going on here? What do we need to do?
Yeah, so this concern is probably one of the largest reasons, perhaps second to I just don't want to know what's in my DNA, right? It is one of the largest reasons why people are afraid to get this type of test, which I think is just so heartbreaking. But people have the right to be afraid. There's a couple things that I think should really be highlighted when it comes to data privacy, genetic data privacy. Number one, there is a law called GINA, and GINA is the Genetic Information Non-Discrimination Act. GINA is a federal law that protects individuals from being discriminated against because of their particular genetic makeup. And what that means is an insurer cannot hike up their rates or discriminate against you for any reason that pertains to your genetic makeup. So you are protected in that regard, okay? GINA does not apply to life insurance in every state. There are some states that do apply GINA to life insurance and some states that don't. So it's important to know what state, if your state in particular uses GINA for life insurance. But those are regulations that are here to protect you. Now, beyond GINA and beyond HIPAA, of course, and beyond just the standard healthcare privacy laws, when it comes to genetic information, there really aren't a tremendous amount of regulations that protect you. And the courts in the United States essentially have deemed genetic information that leaves your body in the form of tissue as not yours anymore. And so the companies in this country, as long as they abide by HIPAA and they abide by GINA and they abide by the laws that are here, right? They can kind of do whatever they want with your genetic information. Now, the important thing to do as the consumer is to know the corporate policy of the company you're working with. For example, Panacea, myself and my founding team believe that your genetic information is not our genetic information. It is your genetic information, which is why we do not do anything with your genetic information that you do not allow us to do. That includes sharing it. It includes monetizing it. It includes donating it to research or sharing it with researchers or pharma. We do not fiddle with your genetic information unless you want us to. And that is our corporate policy. That is not the corporate policy of almost every other genetic company, because genetic data can be very lucrative. It can be very easily monetizable. And so we believe that the right thing to do is to get the permission and the agreement of the person who owns that data, which is you. That's how I would hope my genetic data is dealt with. And that's why we have that stance as a corporation. We do not do what all the other companies like to do with genetic information. It's just not, it's not part of our philosophy.
Well, I certainly agree with you, but what you said doesn't give me a lot of reassurance, in the sense that uh, companies, not to mention any names, there's a $6 billion consumer genotyping company that's now worth zero or near zero. I won't mention their name, 23andMe, but they they had a policy that the data will never be resold and never be available. But now the company is being resold, and whoever buys the company doesn't have to abide by the previous corporate rules, and they will buy that data. So, I mean, it's just, it's a cautionary tale that and I applaud your company for taking that position and taking a stand. But, quite honestly, it's only a boardroom vote away from changing the policy. You know how it is. So as consumers, we have to be aware of it.
Absolutely. And I think it's something that everyone needs to be informed about and to make decisions, based on the information they have. But I do encourage you to sort of explore the companies that sort of are willing to take a stance against this unfair and unjust sharing and monetization of data against the user's will. There's a lot of companies that are actually using blockchain technology to give the user complete control over their data. So they can actually remove their data from the databases of a lot of these companies themselves. And so the autonomy and the control and transparency is certainly growing, especially with companies that sort of believe that this information does not belong to the company, it belongs to the user.
How do you guys feel about that? Are you have you looked into using blockchains for your?
Yeah, we're actually exploring partnerships with companies that do exactly that. They provide us the technology that essentially enables unparalleled transparency and authority for the user over their data. So we absolutely are moving in that direction.
Oh, that's great. Well, going back to one other thing you said that I just wanted to underscore was that a lot of people don't want to know their genetic results, because, I mean, famously, there's an actor who on a longevity TV show had his, I think it was genotyping, but anyway, he was found to have ApoE4 bilateral alleles, which is a risk factor for Alzheimer's and cardiovascular disease,
Sure.
and he was devastated. But the message is, a lot of the diseases, certainly not all of them, but a lot of the diseases that we could pick up risk factors for are influenced by lifestyle. And even Alzheimer's disease, as we've talked about in this program, and cardiovascular disease is dramatically affected by choices we make in the lifestyle. And
absolutely,
all these diseases arise years to decades before the doctor will ever diagnose them. So the sooner you know about your risk, the sooner you can begin implementing these changes in your life that downstream may delay or even, prevent you getting these diseases if you push it back far enough. So
sure.
I'm certainly of the philosophy, I want to look under the hood. I want to know it's there. And I think that's, given the breakthroughs that are happening in medicine today, that's a much, much better way to look than just saying, hey, I don't want to know, surprise me.
Exactly. Exactly. No, exactly. And as you mentioned, a lot of the risks that can be identified today actually have medically available interventions. Not all of them, as you mentioned, of course, but many of them do. And so, especially with those specific risks, you can take action today to minimize and in some cases eliminate your risk for these things. I'm actually a primary example. I had my exome sequenced through my company, and I found out that I have a genetic risk that makes me 9 times more likely to develop ovarian cancer than the average woman. The irony to this is I would never have qualified for genetic testing through our healthcare system today. Never. I don't have a family history of ovarian cancer. I don't have a personal history of ovarian cancer or a related disease. And so I would have never known this information. But now that I do know this information, I can get ahead of it. I can essentially team up with my physicians, which is something I've already done, to talk about what my options are. Can I do more frequent screenings? Can I take certain medications? Are there potentially preventative surgeries that I can have in order to reduce my risks? And so all of this information is given to me and now within my control and within my grasp, simply because I received a genetic test through Panacea that I never would have gotten anyhow. And so now I'm the one in control of my genetic destiny, not the reverse. And that is the case with a lot of people who do find risks in their genetic tests. So this is really meant to be empowering, not meant to be scary or to give you, a written in stone death sentence. None of this stuff is really written in stone. It's a risk assessment. And so you certainly can change your behaviors in order to hopefully minimize your risk.
Now, your particular company, you said it does this clinical grade whole exome sequencing. You need a doctor's prescription for that. So they need to go to their doctor first and be referred to you, or they can go
No.
directly to you and you will take care of that. Is that right?
Yeah, yes,
Mhm.
we absolutely take care of it. So we wanted to make this process as easy and simple as possible for the average person, because today in healthcare, it is so difficult to get this type of test. And we wanted to change all of that. And so you actually don't even need to get your doctor to order this for you. Our partner physicians will review your forms and will essentially order it for you, pending, of course, there's no glaring, contraindication to getting this test. And so we make that barrier almost non-existent. And so all you need to do is essentially go to our site. You can use a credit card or HSA or FSA even to purchase a test. And you fill out a form. Our doctors review the form. Our forms get sent to our laboratory, of course, once they're authorized by partner physicians. Our labs will send you a kit directly to your home. It's so simple, as Dr. Lufkin just showed. It's just a cheek swab, and you swab your cheek. You send it in a prepaid envelope back to our partner labs, and within 21 business days, your whole exome will be sequenced, and you should receive a report from our team. Many people will receive a completely empty report, which is the most beautiful thing. That's exactly what everyone would hope to see. You want to not have any known risks today. And so just as much as you're purchasing information on your genes, you're also purchasing peace of mind in those particular cases, because it really means that you just don't have any high risk genes that are identified. And that's a wonderful, wonderful thing. Once you get your report, you can also sit down with our genetic counseling partners for an hour to look over your report and understand what your report means and what it doesn't mean. No matter what results you have, even if your report is completely empty, it's really important to sit with a genetic counselor to understand what that means. Does it mean that you're never going to get cancer or neurological issues or anything else? What does it really mean for you? And so all of that entire experience is what Panacea delivers. And it is the true comprehensive A to Z experience. In healthcare, in today's healthcare, this experience that will take you just a few weeks from beginning to end could take you months. And that's if you even are able to ever get it. And you're certainly not going to get it covered by your insurance company in most cases. And so we sort of address these barriers in a very simple, user-friendly workflow.
And you mentioned, I mean, it's just a cheek swab. It's a simple test. So what are the contraindications? Like, who should not get this test? I mean, there's no risk from the test itself, but what sort of other risks are there that would prevent someone from getting this, or who shouldn't get it?
Yeah, great question. So just like you said, there's almost no physical risk, right? This is not a biopsy. It is not invasive. It's not even a blood draw. There's no needle going in your arm or anything. So the physical risk is almost non-existent. The technical risk of the test is also incredibly low, right? There are error rates, of course, just like with any test, but because the technology is so advanced and there's so many redundant technologies that go back and take a look at the results that come off of these machines and resequence certain pieces that maybe were not sequenced very well, the error rates are so low. So false positives and false negatives, incredibly low. So again, risk there is quite low. The risk I think that might be the highest for this type of test is the psychological and emotional burden that could come with this type of test. And so not every candidate is, or not every individual is a great candidate for this type of test. Because if you are the type of individual that is going to be more overwhelmed and more stressed, and feel more burdened with this information, even if you can do something about this information, this might not be the test for you. But if you are the type of individual who feels empowered and more in control of your health by having this type of information, then you're a great candidate for this. And so we always mention the fact that not everybody is going to do well with this test and do well with the information that comes off of this test. Most people will, but not everybody. And so you sort of have to consider that about yourself. Is this information going to empower me and make me feel in control? Or is this information going to make me feel worse? It's a good question to ask yourself.
Yeah, it's great that you all pay attention to that. Well, how can people follow you on social media? And could you tell us the name of your website so that people can go there if they want, Dahlia?
Sure, absolutely. And I think you'll also be able to link it as well, perhaps in the show notes, Doc.
Mm-hmm.
But our website is seekpanacea.com, seek, S-E-E-K, panacea, P-A-N-A-C-E-A.com. And that's where you can buy a test. Also, you can follow us on Instagram at panacea_genomics. We always are launching promotions and discounts on our test. I'd love to offer your audience a 20% discount so they can use, I'll send you the discount code, Doc, so you can put it in your show notes. All of your listeners can purchase the Panacea test at 20% off, which saves you about $200. And of course, if there are any questions, you can always go to our website, reach out to us on our contact form. You can email us at contact@seekpanacea.com as well. If you have any questions, we're happy to help, but we would love for everybody to follow us on Instagram.
Well, thanks so much, Dahlia, for spending time with us and educating us a little bit about your kit. And I look forward to speaking with you again to talk about in detail the results. But thanks so much for today's episode.
Absolutely. Thank you so much. And fingers crossed that you receive the most boring result report ever.
If you are enjoying this program, please hit that subscribe button, or even better, leave a review. Your support makes it possible for us to create the quality programming that we're continually striving for.
Can I start? Is it recording?
It's already recording.
Oh, sorry. This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling. The practice of medicine or the provision of healthcare, diagnosis, or treatment, or the creation of a physician, patient, or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time. You should say that.
That's good. That's pretty good. I think that's pretty good. You like it? You want to do it one more time, or is that good? I think that was good.
Yes. All right. You need to save the recording.
Very good.